właściwie nie robiłam prawie nic wtedy. Ale to było emocjonalne zerwanie.
Okay. And since then your knee has been, has pain or discomfort somehow? Or?
Ja w ogóle byłam skierowana na operację. Nie zrobiłam jej. I to jest długa historia z tym kolanem.
Okay. We don't have to hear the whole story.
Okay.
Okay, and now how bad is it? Like you can't do what, or it hurts when, or hurt, yeah?
Generalnie jest w porządku, ale na przykład właśnie teraz w czasie tego remontu czułam, że coś w środku jest inaczej niż powinno być, bo jak klękałam, to bardzo ostro mnie bolało w jednym punkcie. To było zwyczajne klękanie.
And now? Right now?
Staram się nie klękać, boję się.
No, but you feel any pain now? Yeah?
To jest świeży ból.
Yeah? And if you kneel down now? Just try. It's not going to hurt you. I mean, it might hurt, but it's not going to injure you, right?
Teraz jest okay, bo to nie jest it's not hard.
It's not a hard surface, so
soft.
It's a soft
it was on hard flat.
But if you bring your buttocks closer to your feet. No, sit really.
It's okay.
Oh, so it's not very bad, your knee, right now, huh? I was hoping for like some more. No, not for you, but just for the demo. You know. Okay, but it's not very bad. Yeah, can you stand on one leg? That's a good question. Stand on one leg and twist. No, this leg, obviously. And just turn. Does that hurt your knee? No. And when you squat like this, does that hurt your knee? Further? A little bit there, huh? It's just a little, huh? Not a point, yeah. Okay. Okay, good. Okay, lie on your back. Okay, I've been doing this in the it's her left knee, but I've been doing this when I walk around tables a little bit, and I see some people are picking it up, which is just this basic thing of bringing the two bones, the tibia and the femur in that joint together and rotating. And then moving it apart. So it's like this. Yeah, I'm getting release in the knee this way. Yeah, it's nice motion. That hurt? That hurt your knee? Here?
Yes.
Yeah? Okay. Okay, so I'm just going to start to work. How we would work with pain or no pain. I'll just go through a kind of... I like to do that, and then I like to come and do some just general stretch, like count all around the knee. And you can ask the person to bring their knee up.
Można poprosić osobę, żeby uniosła kolano.
Bring your left knee up.
Podnieść trochę kolano, tak. Podnieść troszkę.
Yeah. A little bit. Keep going.
I cały
Up.
czas kontynuuj.
Bring it up.
Troszkę wyżej.
Up.
W górę.
Further.
Jeszcze.
Okay, and down.
I teraz
Okay, and again, I'll do it again. She brings her knee up.
ona unosi kolano.
And I just stretch the fascia all around the knee like this. And she brings it down. Down. And then I can go a little bit more superior, a little higher up on the knee. And she brings it up. Up. And down. And you can, that's a nice way to get started. Like I said before, you think the pain is always deep, and it might be, but it's often superficial fascia contracted, which has more sensory nerves. So like sometimes I'll be doing this and then I'll stand them up and it's gone. The pain is gone. Here, huh? It's here. Yeah, exactly. It's chronic pain, I would do the same. Exactly the same. I mean, if it's so bad they can't hardly move their knee, then you don't do the movement part, but yeah. So then I can just do this side where she has the pain while she lifts her knee with the palm slow. See how I'm really over her knee. Look, I straddle her here so that I can really drop my weight through.
Every time she's lifting her knee.
Yeah, I'm asking her to lift so that she participates. She's participating in the release with me.
It's quite nice, but painful.
It's quite nice, a nice pain.
Nice pain.
To jest taki przyjemny ból,
Okay.
Strong.
ale mocny.
Okay. So then with my fingertips, I'm going to go in this area where she's
Będę teraz rozciągał ten
right there.
obszar,
She has the high level.
tam gdzie ma ból.
It's contracted, yeah.
To jest,
It's 9.
to jest 9.
Okay. So I'm right on the bone. And remember I talked about working on the periosteum.
Pamiętacie, jak mówiłem
So,
o
how is it now?
powięzi, która otacza kości? Jak
How is it now?
Ile to będzie? 7.
Okay, so it's highly
To
sensitive
jest bardzo wrażliwe,
because I'm not pushing very
bo
much.
ja nie naciskam zbyt mocno. Can you feel the contraction? Czy czujesz tam
It's so bony that I don't particularly feel contraction. No.
Nie wyczułam szczególnie zacisku. On the muscle insertion? Czy to jest
It's
na
on the
przyczepie
ins-
mięśnia?
close to the insertion of the iliotibial tract.
Tego pasma
Like right through here.
biodrowo-piszczelowego.
A lekarz powiedział, że w tym miejscu jest stan zapalny.
My doctor said that there is an inflammation in this area.
Is it, do you feel it? Or?
Czy wyczuwasz tam stan zapalny?
No, I don't feel it. I don't see it. I don't feel
Nie
it.
widzę go, nie
It's not warm. It's not
Okay.
swollen.
I'm sorry, what did you say?
It's not warm or swollen
Nie
or
jest rozgrzane, nie jest
okay.
doesn't feel
wsunięte,
inflamed.
But it's painful.
ale jest bolesne.
It's tight. It's tight.
Jest zaciśnięte.
For what, and, you know, she had all that problem through the injury.
Oh.
What was that?
She had the problem through the torn ligament, and then
Miała problem, bo miała zerwane ścięgno. There is a question here.
Więzadło krzyżowe przednie.
Przepraszam, wiązadło krzyżowe przednie. There is a question if you feel this kind of tissue, scar tissue under your finger.
no, I don't feel particular. I just feel tension.
Nie nie wyczuwam, tylko napięcie.
Yeah. And I don't hardly feel the tension because it's so bony.
I nie wyczuwam
Yeah,
napięcia,
I just see her pain reaction.
kościste.
I don't have to push much and she's,
Nie muszę dużo
it hurts,
naciskać,
yeah.
a ją już bardzo boli.
So I'm just going to go all around with my fingers in the area where she has pain.
Wszędzie wokół tego obszaru, gdzie doświadcza bólu, pracuję palcami.
To keep releasing it.
Żeby kontynuować
Up here she says it's really stronger, the
Tutaj
pain.
mówi, że to jest bardzo mocne.
Okay, so.
But it's better.
Ale czuję, że jest lepiej.
Przyzwyczaiło się.
Okay.
My knee got used.
Yeah, good. So right under the patella, I'm not going to just work that area, I'll come back to it. Right under the patella
Nie będę pracował
is this patella tendon from the quadriceps. These muscles in the front of the thigh. Yeah, it's like a tendon, really.
Tutaj jest wiązadło, tak?
It's kind of combination of a tendon ligament, really, because these muscles attach to the patella, and the patella attaches to the tibia.
Łączy się z rzepką, a rzepka
It's nice to go in with your thumb.
Miło jest popracować tutaj kciukiem.
Breathe, yeah. Good, good, good.
Control place?
It's a really, usually a place when there's, even with everybody, you can just, it doesn't matter if they have pain in their knees or they just have no pain and you're just trying to work to release and open their knees.
Dobrze jest pouwalniać.
It's just a good area to work, right under there.
To jest dobry obszar do pracy.
Is that okay, my love?
Yes.
Czy tak jest okej?
Yeah, it's okay.
It's quite
It's great.
To jest bardzo
Also
dziwne.
now I feel czuję jak to się jakby zapada.
I feel like
Nie
if it
trzymało.
were collapsing, as if there were not enough holding there.
Okay. It's just letting go, and that's how she interprets it,
Uwalnianie, a ty w ten sposób to interpretujesz.
I think.
Tak myślę.
So this is a nice thing to do. You get both, you get your thumbs as a fulcrum,
Fajnie to zrobić.
and you take both fingers right under the knee, your thumbs as a fulcrum,
Kciuki są wsparciem dla palców,
And
a
right
palce są tuż pod kolanami.
fingers here, and then you just stretch,
I używając w ten sposób palców rozciągamy to
stretch
rozciągamy.
across like this.
Całe kolano. Is it the mobilization of patella? Would you advise it here?
You mean to do this?
Zrobienie czegoś takiego?
No, I don't know.
Nie wiem.
I don't do that,
Nie robię.
but you can.
Można.
I never do that,
Nigdy tego nie
but you can. So I'm going to work all around this area above the patella, where these muscles come in and attach.
Tam, gdzie są przyczepy.
These big quadricep muscles, yeah?
To jest przyczep mięśnia czworogłowego.
They come in and attach here, and oh, nice. And I
Nawet nie jest bolesne, ale jest takie...
What?
Dużo lęku mam w tym
It's not so painful in general, but there is a lot of fear around this area.
Okay. Breathe into the fear, yeah? And just allow the fear to be there. Don't try to block it.
Żeby on tam był. Nie staraj się.
Knees hold a lot of fear,
Kolana wstrzymują bardzo.
and so don't try to block it,
Nie
yeah.
staraj się.
Just let it shake or whatever it wants to do in your body, yeah.
Trzęsanie albo cokolwiek twoje ciało chciałoby zrobić.
That's it, good. Just allow.
Po prostu przyjść.
Yeah. Oh, and then I'm going to go here. A lot of people have problems in the medial aspect of their knee.
Wiele osób
Huh?
ma przy środkowej
like
części
through
kolana.
here. That's where I had it. That's where most people have it.
Większość
through
ludzi
here.
ma tu właśnie po tej stronie.
Yeah. So you can also just work it.
Więc można też popracować.
Yeah. If your fingers get tired, you can come under the knee
Możecie wejść
with your fingers and then just work it with your thumb.
i popracować kciukiem od spodu.
Or with your fingers. See how I use my thumb?
Widzicie, jak używam kciuka?
Yeah, allow the movement. Yeah.
O, dużo ruchu się
Allow any movements. Yeah. You can also come from up and work down.
w górę, czy możesz też
So
pracować
it's
w dół?
okay. I find it easier to work up, I think. And I like to stay in contact with her face
W górę i też
and
lubię
kind of
być w
be able
kontakcie
to
z
see
twarzą,
her breath. And
żeby widzieć, jak oddycha.
sometimes you can try both at the same time like this. It's very nice. And you just push off your thumb,
Pchamy, odpychając,
dropping a little weight.
używamy naszego ciężaru, też osuwamy nasz ciężar wraz z ruchem.
Great. With the sounds. Yeah. All the way around the knee. And you can come under like this. And then bring your thumbs in here and just start to get a little motion through the knee.
Zawracamy kciuki
And just hold it.
i wprowadzamy więcej
Just
ruchu.
allow your tears, my
Podtrzymujemy.
love, allow your tears if they come with the breath.
Under the patella,
Yeah, and I'm just getting movement through the joint.
wprowadzam ruchy stanu.
See? Kind of like that wave we've been doing with Simon.
Tak jak dzisiaj robiliśmy falę na Qigong'u, to trochę jak ta fala.
And then you can work the back of the knee
Pracujemy
just with your fingers
tylnej
curled
części kolana, podwijamy palce
and stretch back.
i rozciągamy w swoją stronę.
Yeah. Here's the fibula, the head of the fibula.
Tutaj mamy główkę.
It's nice to take the head of the fibula and just move it, articulate it, mobilize it through.
Poruszyć też trochę, wprowadzić tego rucha.
She has movement there. Some people don't.
Wiele osób nie ma tutaj zdolności.
Okay, I'm just really working all around this head of the fibula.
Pracuję teraz nad główką kości
Again,
strzałkowej.
some more superficial work. And I want to acknowledge her tears, yeah? Just not let her cry without saying something.
Żeby nie płakała bez.
Can you share what you're feeling with the tears?
Chcesz się podzielić tym, co czujesz?
What it is? It's sadness?
I don't know.
It's emotional pain.
Uwolnienie.
Relief.
Release.
Release. Okay. Okay.
Poruszenie. wzruszenie.
She's touched. Okay, so it's a positive kind of thing. Kasha, she's been, I imagine that she's been dealing with her knee since the injury somehow. Yeah. 5, 6 years. And now she feels somebody going in and really releasing areas that have been holding and helping and healing her, helping the healing of her knee, and touches her. Yeah, even you have pain for a long time. It's touching. Oh, that's what I imagine. Okay, now the quadricep. We're going to just go one stroke up the quadricep, right at the top of the knee. I start right at as close to the patella as I can get, and I go in, and then I stretch right up that medial quadricep. The rectus femoris, huh? That medial quadricep. Rectus femoris is its name. And then I stretch. And I stretch. Just the back of the hand. You can also play with your palm here. It's okay. Or a flat forearm. And stretch. Okay, I'm not going to do anything quick. Yeah, I'm just going to stretch. So again, I'm just going to stretch her knee without doing what I did yesterday with Ava, which was an adjustment. I won't do the adjustment. This is a nice stretch. You just bring your lower forearm up here, and then you can really stretch the fascia and the ligaments, which are also fascia ligaments. And you can stretch them and just rotate at the hip and stretch, and then come out and stretch. You don't have to stretch hard, or you just stretch. And if I don't want to include the ankle, I come above it. Yeah, stretch the knee. And back to this again. Nice thing to do, this is what I do. You're here, and say she has pain here, right? So then I'm doing this movement, and I just bring my thumb into the area. Kind of just fits. Perfect. It fits where I just bring my thumb through that area. Where in this case, she has the pain. So I'm compressing. Another nice thing to do with the knees is to take like this and just get movement from the tibia on the femur, right at the knee joint. Pushing, pulling. Like this. And then you can also, when they're up, you can come right in that joint. And she continues to have tears. Huh? Oh. Somebody give her a tissue. You can take the head of the fibula and move like this. Movement through. Stretch. mobilize that. You mobilize the tibia on the femur, and also you're mobilizing the hip,
do kości piszczelowej, udowej i też
and then the head of the fibula. Which one? This one? It's all traction.
wszystko to jest.
You're just pulling. You're not compressing. This is compression, yeah. But that other one wasn't. Okay. The other thing I always tell people is be patient
Kolejna rzecz, którą zawsze ludziom
when they have pain.
tłumaczę, to bądźcie
That it's a process of treatment. Not.
proces.
They might even get better in one treatment, right?
Po
But
jednym
then I want to
sesji
do
może się
more.
poprawić, ale chcę zawsze zrobić więcej.
And that it's a process, and sometimes they go 2 steps forward and 1 step
I że
back.
czasem ten proces jest taki, że
And they
dwa
need
kroki
to
do
find the
przodu, dwa kroki do
patience
tyłu.
and just be
I że
with it and
potrzebują znaleźć
appreciate the
docenić
healing that's happening, and
proces uzdrawiania, który
over
się
time
wydarza.
it'll get better,
Że on potrzebuje czasu.
and they'll feel better, and they'll feel more connected, and they'll feel less, the pain will go away. But I really reinforce this thing of be patient within this time we're together. It's a process, and that we're on together, and I'm really here, and I tell them, I'm really confident we can help you.
I mówię im, że naprawdę
And I don't know for 100%, but I'm confident.
że mogę pomóc. To znaczy nie mam 100%.
That's also important for them to hear.
Całkiem
Yeah? Because, then they feel, oh, finally. Especially if it's a chronic story.
osoba może odetchnąć, szczególnie przy chronicznym.
Which in her case, it's a chronic story, kind of.
Trochę chroniczne, ale
It's not a really strong situation, but it's there. Yeah. Okay, we haven't really worked the quadriceps. We'll do that later today. We'll do it next. But I just did this one stroke up the middle, like hooking the top with my hand, and then stretching. Also, here's the lateral quadricep. Yeah. Okay. How you doing? Better?
Yes, it's moving. Something about symphony.
it's somehow about trust.
Something about trust. Amen.
Trust in men.
Zaufanie do nas.
And let him do something.
What?
Let him do something with my body.
I przyzwalanie